Are you preparing for an NHS interview and wondering how to tackle those tough behavioral questions? You're in the right place. In this video, I'll walk you through some of the most common NHS behavioral interview questions and provide expert answers to help you stand out. Whether you're applying for a healthcare assistant, nurse, or support worker role, these tips will boost your confidence and increase your chances of success. Let's dive in. 1. Tell me about a time you had to deal with a difficult patient or colleague. There was a time when I was working on a busy ward, and I had a colleague who was visibly stressed due to the heavy workload. They had started to become short-tempered with both staff and patients, which was beginning to affect team morale and patient care. I could see that their frustration was not intentional, but rather a result of the pressure they were under. Recognizing the situation, I approached them privately and asked if they were okay, offering them a moment to step away and take a break if needed. I listened to their concerns with empathy and reassured them that we were all in this together as a team. To ease the workload, I offered to take on some of their tasks where possible and encouraged better coordination among the team so that no one felt overwhelmed. Additionally, I suggested that we speak with the senior staff to see if any adjustments could be made to our workflow to improve efficiency. As a result, my colleague appreciated the support and gradually regained their composure, which improved communication within the team. The atmosphere on the ward became more positive, and patient interactions improved as well. This experience reinforced for me the importance of teamwork, emotional intelligence, and looking out for colleagues, as a supportive environment ultimately benefits both staff and patients. 2. Can you describe a situation where you had to work under pressure? There was a time when I was working in a busy hospital ward, and we suddenly experienced an influx of patients due to an unexpected emergency incident in the community. The ward was already understaffed that day, and the sudden increase in patient admissions created a high-pressure situation where we had to act quickly while ensuring patient care remained our top priority. My task was to assist in managing patient flow, coordinating with other healthcare professionals, and ensuring that every patient received the necessary care in a timely manner. Recognizing the urgency, I remained calm and focused, prioritizing tasks based on clinical need. I worked closely with my colleagues to delegate responsibilities effectively, ensuring that critical cases were attended to first while maintaining clear communication with doctors, nurses, and administrative staff. Additionally, I reassured patients and their families, keeping them informed and providing emotional support during a stressful time. As a result, despite the challenging circumstances, we were able to manage the situation efficiently, ensuring all patients received appropriate care without compromising safety or quality. My ability to stay composed, work collaboratively, and adapt to pressure was recognized by my team, and it reinforced the importance of teamwork and effective communication in high-pressure healthcare environments. 3. Give an example of when you went above and beyond for a patient or colleague. There was a time when I was working on a busy ward, and one of my elderly patients was visibly distressed. She had been admitted unexpectedly and was feeling confused and anxious about her treatment plan. Despite completing my routine tasks for the shift, I could see that she needed extra reassurance. So I took the time to sit with her and listen to her concerns. She confided in me that she didn't fully understand what was happening with her care and was worried about being alone. Recognizing the importance of clear communication in patient care, I liaised with the medical team to get a simplified explanation of her treatment plan, and then carefully explained it to her in a way that she could understand. I also contacted her family to provide updates, ensuring she felt supported. To help ease her anxiety, I checked on her regularly throughout my shift, making sure she was comfortable and had everything she needed. As a result, her anxiety significantly reduced, and she became more cooperative with her care plan. Before being discharged, she expressed her gratitude, saying that my kindness had made a real difference during a difficult time. My manager also acknowledged my efforts in ensuring patient-centered care, This experience reinforced my belief that going the extra mile, even in small ways, can have a profound impact on a patient's well-being. Before we proceed further in this video, let me share something that will help you excel in your next interview. If you want to confidently answer any behavioral interview question, you need the 500 Behavioral Interview Questions and Answers ebook. What's inside? Top 300 Behavioral Interview Questions and Answers for all job roles. Top 200 NHS Behavioral Interview Questions and Answers for healthcare professionals. Bonus: free expert tips on how to master the STAR method and impress any recruiter. Get it now at 50% off. Click the sealer or fourth wall link in the description to download your copy. It's super affordable. For more details, chat with our online customer care on WhatsApp or email. Now, let's get back to the video. 4. Tell me about a time you made a mistake at work. How did you handle it? There was a time when I was responsible for updating patient records in a fast-paced clinical setting. Due to a particularly busy shift with multiple urgent cases, I inadvertently entered a patient's follow-up appointment details incorrectly. I realized the mistake later that day when reviewing my notes. Understanding the importance of accurate records in ensuring patient safety and continuity of care, I immediately took action to correct the error. First, I informed my supervisor about the mistake and took responsibility for it. I then checked the system to see if the patient had already been informed of the incorrect appointment time. Since they had not yet received the notification, I quickly updated the records and ensured that the correct details were sent out. I also contacted the reception team to confirm that the patient would receive the right information. To prevent similar mistakes in the future, I developed a habit of double-checking all entries before finalizing them. Additionally, suggested implementing a verification step where another team member cross-checks critical patient details, which was well received by my manager. This experience reinforced the importance of accuracy and accountability in healthcare, and it taught me to be more mindful even in high-pressure situations. 5. Describe a situation where you had to adapt quickly to a change in the workplace. There was a time when my department underwent a sudden change in procedures due to the implementation of a new digital records system. The transition was unexpected, and many staff members, including myself, had to quickly learn the new system while ensuring that patient care and administrative tasks remained efficient. My role required me to adapt quickly and support colleagues who were struggling with the transition. I took the initiative to familiarize myself with the system by reviewing training materials and seeking guidance from IT support. Once I became comfortable with the new software, I assisted my team by explaining key functions and troubleshooting common issues. I also suggested a structured approach to learning, where we set aside time for short training sessions, allowing everyone to adjust without disrupting workflow. As a result, the team adapted to the new system more smoothly, and we were able to minimize delays in patient record keeping. My proactive approach helped reduce frustration among colleagues and ensured that the transition had minimal impact on service delivery. This experience reinforced my ability to remain flexible and solution-focused when faced with sudden workplace changes. 6. Can you give an example of a time when you had to advocate for a patient's needs? There was a time when I was caring for an elderly patient who had multiple complex medical conditions and was struggling with communication due to a recent stroke. During my assessment, I noticed that the patient appeared to be in significant discomfort, but they were unable to clearly articulate their pain level. The medical team had prescribed a standard pain management plan, but based on my observations and my understanding of the patient's condition, I felt that their pain was not being adequately controlled. Recognizing the importance of advocating for the patient, I escalated my concerns to the senior nurse and requested a review of the pain management plan. I provided clear observations, including changes in the patient's vital signs, nonverbal cues indicating distress, and their limited ability to communicate their needs. I also engaged with the patient's family to gain further insight into their usual pain tolerance and previous pain management strategies. As a result, the medical team reassessed the patient's pain relief regimen and adjusted their medication accordingly. The patient became significantly more comfortable, which improved their overall well-being and ability to participate in rehabilitation. My advocacy not only ensured that the patient's needs were met, but also reinforced the importance of holistic and patient-centered care. This experience strengthened my commitment to always speaking up when I see a patient in need, and ensuring that their voice is heard, even when they are unable to express it themselves. 7. Tell me about a time you worked as part of a multidisciplinary, in my previous role. I worked as part of a multidisciplinary team to develop a care plan for a patient with complex medical and social needs. The patient had multiple long-term conditions, including diabetes and heart disease, and was also experiencing mental health challenges and social isolation. Given the complexity of the case, our team included doctors, nurses, physiotherapists, occupational therapists, social workers, and mental health specialists. My task within the team was to ensure a coordinated approach to the patient's care, particularly in managing their diabetes and ensuring their nutritional needs were met. I collaborated closely with the dietitian and community nurse to monitor blood sugar levels and provide dietary guidance. Additionally, I worked with the mental health specialist to address the patient's anxiety, as their mental well-being was impacting their ability to manage their physical health. To ensure effective teamwork, we held regular meetings where each professional provided updates and discussed any concerns. I actively contributed by sharing my observations, asking relevant questions, and ensuring that the patient's voice was central to the decision-making process. I also played a role in ensuring clear communication between the different specialists, which helps streamline care and avoid duplication of efforts. As a result of our collaborative approach, we were able to create a personalized care plan that addressed the patient's medical, emotional, and social needs. Over time, their conditions stabilized, and they reported feeling more supported in managing their health. This experience reinforced the importance of multidisciplinary teamwork in delivering holistic, patient-centered care, and highlighted the value of clear communication and collaboration in achieving the best outcomes for patients. 8. Give an example of when you had to handle confidential or sensitive information. In my previous role, I was responsible for handling patient records and confidential medical information as part of my daily duties. One particular instance that stands out was when I was assisting with updating patient files for an internal audit. During this process, I noticed that one of my colleagues had inadvertently left a file containing sensitive patient data unattended on their desk while they stepped away. Given the strict confidentiality policies within the NHS, I knew this posed a potential risk of unauthorized access. Understanding the importance of maintaining patient confidentiality, I took immediate action by securely storing the file in a locked cabinet and informed my colleague privately upon their return. I also took the opportunity to gently remind them about the importance of safeguarding sensitive documents, ensuring the conversation remained professional and constructive. To reinforce best practices, I later suggested to my manager that we conduct a short refresher session for the team on data protection and information governance. As a result of this proactive approach, my colleague was more mindful of handling confidential documents, and the team as a whole became more vigilant in protecting patient information. This experience reinforced my understanding of the NHS's commitment to confidentiality and the critical role each staff member plays in safeguarding sensitive data. 9. Describe a time you had to manage multiple priorities at once. There was a time when I was working in a busy healthcare setting where I had to manage multiple priorities simultaneously. On one particular shift, I was responsible for overseeing patient care, ensuring documentation was completed accurately, and responding to an urgent staffing issue. In addition, I had to coordinate with other departments to facilitate a smooth patient transfer, while maintaining high-quality care for my assigned patients. Recognizing the urgency of the situation, I quickly assessed the most critical tasks and prioritized accordingly. Patient safety and well-being were my top priorities, so I ensured that all essential care was delivered promptly. At the same time, I delegated non-urgent tasks to colleagues who had capacity, ensuring that the workload was evenly distributed. To manage the staffing issue, I liaised with the senior nurse on duty to arrange cover while keeping the team informed of any changes. Throughout the process, I remained calm, organized, and communicative, ensuring that no aspect of patient care was compromised despite the competing demands. As a result, the shift ran smoothly, the patient transfer was completed without delays, and all necessary documentation was finalized on time. My ability to stay composed and effectively manage multiple priorities was recognized by my manager, who commended my problem-solving and leadership skills. This experience reinforced the importance of adaptability, teamwork, and clear communication when handling high-pressure situations in a healthcare environment. 10. Tell me about a time you received constructive criticism. There was a time when I was working on a patient care project that involved streamlining administrative processes to improve efficiency. I had spent weeks developing a new workflow and presented it to my manager, believing I had covered all aspects thoroughly. However, after reviewing my proposal, my manager provided constructive criticism, pointing out that while the process was efficient, I had not fully considered the potential impact on staff workload or patient experience. She suggested that I gather more feedback from frontline staff before finalizing the changes. Initially, I felt slightly disappointed because I had put a lot of effort into the project, but I recognized that the feedback was valuable. Instead of dwelling on it, I took a proactive approach and arranged meetings with nurses, administrative staff, and other stakeholders to understand their perspectives. Through these discussions, I discovered small but important adjustments that made the new workflow more practical and user-friendly. When I resubmitted my revised plan, my manager praised my willingness to adapt and incorporate feedback. The final process was not only more efficient, but also better aligned with staff needs and patient care. This experience reinforced the importance of being open to constructive criticism and using it as an opportunity for growth. It also strengthened my ability to seek input from others to ensure well-rounded decision-making. Now that you know how to answer NHS behavioral interview questions, it's time to practice and refine your responses. Remember to use the STAR method: situation, task, action, and result, to structure your answers effectively. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more career tips from Damal. Consult Career Academy. Best of luck with your interview, and I'll see you in the next video.